Hello friends, welcome to my YouTube channel as a Tribal Star TV, and my name is Vishal. Today we are going to talk about atropine injection. What is tropine? What is atropine injection? Which brand we get in market this injection, and what is the purpose of this injection? What is the use of this injection? Let us talk about atropine injection. Atropine in India, its brand name is tropine, and company Neon. We get this injection as MRP 4 rupees, and the drug is atropine. Let us talk about why the atropine injection is used and what is its purpose. The alternate brand of tropine injection is Atropa 0.6 mg injection, as the company name is Troika Pharmaceutical. The brand name Atronex 0.6 mg, company name is Indus Pharma. The another brand name Atrovac 0.6 mg injection, and the company is Workhart Limited. The another brand name is ATP 0.6 mg, and the company name is Biomicron Pharma. The another is brand name Melano 0.6 mg, company name is SPM Private Limited. Atropine is used as the preoperative medication for the reduction of saliva and bronchial secretion, for management of bradycardia and acute myocardial infarction. Let us talk about what is saliva. Saliva is the watery substance which have been present in mouth. And what is bronchial secretion? Bronchial secretion is the salivary liquid material which had come from our bronchia at the lungs. This substance which have been present at the saliva in the mouth at the time of pre-operation, yani ki before the surgery, the saliva has been come at the mouth. This atropine injection have been helped to reduction of the saliva at the mouth, and also help to reduce the bronchial secretion. This atropine injection have been used to as bradycardia and acute myocardial infarction. Let us talk about what is bradycardia. The bradycardia is known as slow heart rate. Slow heart rate means what is the actual heart rate, expected heart rate is slower than the heart rate, is known as slow heart rate. Generally the slow heart rate meaning it's beating heart beating as 60 heart rate per minute. Below the 60 heart rate per minute, it's known as bradycardia. The symptoms which have been present in bradycardia is faint or nearly faint, chest pain or feeling chest pain, and difficult in breathing. Let us talk about the treatment of bradycardia. What is the treatment of bradycardia? If the person have suffering from bradycardia, the lifestyle changes is the main reason for the treatment. Main reason is if the treatment is not going to proper, then lifestyle changes is the most important, and medication changes is also important. And if both lifestyle changes and medication changes is not curing the patient, then surgery one is the hope which have been present as implant medical device called pacemaker is the only option for bradycardia. As we talk about the symptoms of bradycardia, and another the disease which have been also the same symptoms which have been present in bradycardia are that the another disease which have been caused as slow heart rate is in thyroid disease and sleep apnea disease, thyroid disease and sleep apnea disease, that have been also presence in slow heart rate. So the only slow heart rate which have been present, is not only the bradycardia, it's also presence in thyroid and sleep apnea disease also. So never judge the only a single bradycardia, it's also the another diseases like sleep apnea and thyroid disease also. This is the basic term of bradycardia. We talk briefly about bradycardia at my next another video. Let us talk about what is acute myocardial infarction. Short form I will explain. The myocardial infarction is also known as blockage of blood flow to the heart. It is known as myocardial infarction, yeah, or MI. Acute or chronic myocardial infarction. Generally, it is known as myocardial infarction. It's simply talk about as heart attack. In medical terminology, the heart attack is also called as myocardial infarction. And a heart attack is the medical emergency. A heart attack usually occur. Heart attack usually occur when the blood supplying to the valve of blood valve, when the blood clot to the blood valve and blood supply have been stopped, and it's called as heart attack. Which organs did not get the blood, then tissue lose organs and dies. Acute myocardial infarction symptoms are tightness in the chest and chest pain, neck pain, back pain, and severe fatigue when the little work, the person have been work little but it's fatigue very much. It is the sign and symptoms of myocardial infarction. And also light headache, abnormal heartbeat to the person, and anxiety. The treatment of myocardial infarction is lifestyle changes, cardiac rehabilitation to the medication, and the last, if lifestyle changes and medication have been not work properly, then the last hope is stent and bypass surgery is the only option for myocardial infarction. We have been explained about bradycardia and acute myocardial infarction in this topic, and again we come to our parent topic is atropine. Atropine injection is also given before anesthesia to decrease saliva. During anesthesia and surgery, atropine injection have been used to keep heartbeat normal for the patient. And atropine injection is also used as in emergency situation when the heartbeat too slowly, as an antidote, for example organophosphate, pesticides, insecticides, nerve gas poisoning and mushroom poisoning. The atropine injection is used for antidote for the patient. Let us know what is organophosphates, insecticides, nerve gas poisoning in this topic. Organophosphates are most popular and one of the most insecticide product in India. Insecticide mean kill, repel and insects and its related substance. The insecticides have been killed. Let us know about nerve gas poisoning. What is the nerve gas poisoning? Nerve gas cause poisoning by damaging nerves that help you breathe, move and digest food. Nerve gas chemical found in pesticides. Patient may be exposed to nerve gas by breathing the fumes and getting it on skin that make patient as a nerve gas poisoning. The symptoms which have been present in nerve gas poisoning as eye burning, tearing, dim vision problem, running nose caused by difficulty in breathing, headache, confusion, weakness, sweating, stomach ache and diarrhea, and muscle twitching also. These have been, we talk about generally nerve gas poisoning, insecticides and organophosphates. Let us talk about again atropine. And the atropine injection, it can be before the part of pre-medication at general anesthesia. Let us know what is anesthesia. The main anesthesia definition is insensitivity of pain, especially the artificially induced the administration of gases or the injection of drug before the surgical operation. In this anesthesia, the body temperature have been fall because of presence in drug administration. Anesthesia meaning the loss of sensation. Medication which have been used in anesthesia are called as anesthetic drug. Anesthetic drug are used during test and surgical operation to numb the sensation and certain area of the body or induce sleep to the patient. The topic we are taking from chapter 8 at anticholinergic drugs and drug acting autonomic ganglia. Let us know what is the classification, and for this definition of classification, we know the atropine sub drug related drugs, what is the classes which have been present in atropine with their surrounding drugs. Let us know what are the drug that have been present with in atropine in this topic. There are three types of subtopics in classification at anticholinergic drugs and drug acting autonomic, that are natural alkaloids. First one is natural alkaloids, second one is semi-synthetic derivatives, and third one is synthetic compound. Natural alkaloids are divided by two types, atropine and hyoscine. These are the classification which I have talking in this topic, and first topic is natural alkaloid, which have been present at atropine and hyoscine. Second one is semi-synthetic derivatives. In this semi-synthetic derivatives which have been present at home atropine, atropine methonitrate, hyoscine butyl bromide, ipratropium bromide, tiotropium bromide. Third one is synthetic compound, in which the synthetic compound have present again subtypes which have been present at mydriatics, antisecretory, antispasmodic, vasicoselective, anti-Parkinsonian. Mydriatics which have been present at cyclopentolate, tropicamide. Antisecretory, antispasmodic which have been again two subtypes which have been present at quaternary compound and tertiary amide. The quaternary compound which have been present at propanthyline, oxyphenonium, clindinium, pipenzolate, methyl bromide, isopropamide, and glycopyrrolate. Tertiary amine have dicyclomine, valethamate, pyrenzepine. Next is vasicoselective. In this vasicoselectives we have present the drugs of oxybutynine, flavoxate, tolterodine. Let us know about anti-Parkinsonian. In this, what type of drugs have been come? Let us know. First one is trihexyphenidyl, procyclidine, biperidine. These are the classification which have been come under the subclass and class of atropine. In this another video, I have been share about the classification. Under this classification, which type of drugs have been come, I will tell one by one their uses and their purpose also. This is the only topic of atropine, so I just give the demo of atropine classification. In my next video I will explain about each and every drugs, what is their use and their purpose. Let us know about pharmacological action of this atropine drug. The action of atropine can be largely predicted from knowledge of parasympathetic response. Prominent effects are seen in organs which normally receive strong parasympathetic tone. It block all subtype of muscarinic receptor, that are central nervous system, central vascular system, eye, smooth muscles, gland, body temperature, local anesthetic. Let us talk about central nervous system and know how the atropine have been work in central nervous system. Atropine has an overall central nervous system stimulant action. However, these effects are not appreciable at low dose, which produce only peripheral effect because of restricted entry into the brain. Atropine stimulate many medullary system. Stimulates mean rise. Atropine stimulate many medullary system. Example, vagal, respiratory, vasomotor. It depresses vestibular. Vestibular means sensory system. That the atropine decrease vestibular system, yani ki sensory system, by blocking the relative cholinergic overactivity in basal ganglia. It suppresses tremor and rigidity in Parkinsonism. High dose of atropine cause cortical excitation, restlessness, disorientation, hallucination, and delirium, followed by respiratory depression and coma. These are the topics which have been present at atropine effect in central nervous system. Let us know about central vascular system. What is the effect of atropine have been occur in central vascular system? Heart is known as the central vascular system. Most prominent effect of atropine is tachycardia. It is due to blockage of M2 receptor on sinoatrial node. through which vagal tone decrease heart rate. The atropine intramuscular or subcutaneous injection in patient initially bradycardia often occur. These are the topics which have been present in central vascular system of the heart. Let us know about the another topic at eye. Let us know the atropine injection what have been occur after it have been administered at the eye. Topical instillation of atropine at the eye cause mydriasis, abolition of light reflex, and also occur as slycoplegia last 7 to 10 days. After administration of atropine, the result of photophobia and blurring of near vision have been occurred. The ciliary muscles have been recovered somewhat earlier in sphincter papillae. Intraocular tension tended to rise, especially in narrow angle glaucoma. Conventional systemic dose produce minor ocular effect. These are the some basic topics which have been come under the atropine which have been administration after before and after the eye. What happening in the eye? Let us know about the topic. Next topic of our smooth muscles. Before the next topic, let us know my upcoming next video have also presents on eye and eye disease. Don't forget to watch this eye and eye disease. This topic is only based on atropine injection for the eye. Let us know about our next topic is the smooth muscles. What effect have been occur at the smooth muscles? The atropine injection in smooth muscles is the drug reaction at the smooth muscles of the atropine is passage of chyme is slow, constipation may occur, spasm may be relieved. Atropine causes bronchodilation and reduces airway resistance, especially in COPD and asthma patient. These are the topics that the atropine injection has been administered after the smooth muscles reaction. Let us know about our another topic that are glands. Let us see what is happening when the atropine injection have been administered after the glands. Atropine markedly decrease sweet salivary, tracheobronchial and lacrimal secretion. Skin and eye become dry. Talking and swallowing may be difficult in the patient. Atropine decrease secretion of acid, pepsin, mucus in the stomach. These are the topics which have been present in the glands. Let us know about the another topic of our topic, the body temperature. What happening when atropine injection have been administered after and before the body temperature have been rises or decreases. Let us know about the body temperature in the human body after administration of atropine injection. The administration of atropine injection rise of body temperature at higher doses. It is due to both inhibition of sweating as well as stimulation of temperature, regulating center of the hypothalamus. Children are highly susceptible to atropine fever. Let us know about our another topic which have been present at local anesthetic. Atropine has mild anesthetic action at the cornea. These are the topics which have been covered at pharmacological action. Let us know about pharmacokinetic. What happening when the drug have been administered at the body, and let us know about the pharmacokinetic topic in after administration of body, the atropine injection. In this pharmacokinetic topic, atropine are largely absorbed in gastrointestinal tract. Apply to eye, there are freely penetrate cornea. Passage across blood-brain barrier is somewhat restricted. About 50% of atropine have been metabolized in the liver and rest is excreted unchanged in urine. It has a half-life of 3 to 4 hours. The dose that have been present in atropine sulfate are 0.6 to 0.6 to 2 mg intramuscular or intravascular. In children, the atropine dose are 10 μg per kg. 1 to 2% of dose, 1 to 2% are topically in the eye. Atropine sulfate 0.6 mg per ml injection and 1% eye drop and 5% eye drop. 5% eye ointment. For watching my video, if you have any doubts regarding this atropine injection, you have been asked about comment in this comment section, below the comment section, and if you want to know another drug topic like buscogast injection, like hyoscine injection, and like a lot of injection, valproate injection, and paracetamol injection. If you want to know about different type of injection, which injection you have been want to know, you can comment me at my comment box. I will try to make video of your known. If you want to know about which type of drug you know, I will try to make the video. And if you have any doubt in this video, you can comment me. I will try to improve the question answer. Thanks for watching my video. All the best for your medical career.